Hi there, I'm Claire McDonnell Liu, and welcome to the Family Health Lab. Today, I'm going to be talking with Dr. Sarah Hancock. I recently met Sarah at a conference, and I was fascinated by her presentation and her research. She spent years deeply delving into the science that connects our oral health with our overall health. It's really fascinating work, and I'll let Sarah tell you about what this could mean for your family's health and what we can do to prevent disease.
You're listening to the Family Health Lab. Healthy parents, healthy kids.
Hi there. Welcome, Dr. Sarah Hancock. Thanks for joining me. It's lovely to see you again after chatting quite a lot at Low Carb Down Under.
Well, it was actually meeting you, Claire, at Low Carb Down Under was one of the highlights of the whole event, really. And it was fun chatting over the course of 3 days as we were attending talks and discussing all sorts of things regarding family eating. And so it's really nice to see you. So hi.
Oh, thank you. That is really kind. And we did really hit it off. I found our conversations really interesting. So I'm so pleased that you're one of the first people that have kindly agreed to pop on and join me and chat about nutrition and health. We talked a little bit about your food journey, your personal and your professional one. But if you want to give me a little outline, if you can, that'd be great.
I've always had a fairly high awareness around food and the effects on health. That probably started essentially when I was about 10 years old, when my sister, who was diagnosed with type 2 diabetes, she was 8 at the time, I was 10. And so as a family, we became very quickly aware of this. First time I'd really thought of carbohydrates as a thing that was in food. And so it was a very early introduction to how what you ate had an impact on your health. Really, I mean, we're a fairly healthy living family. It was fairly rural growing up. And so that was one thing. And then sort of got interested in the whole health and exercise thing because it was something that was being quite closely monitored within our household. And then I went and did a physical education degree, having been sort of told all the way through the 80s and early 90s that, exercise and, doing all that was, the solution to good health and all that. So did an honours degree in which the research experience was really interesting. And then sort of moved on, did some personal training for a while. Finished up in the UK on the overseas experience with my husband and did a master's in health technology assessment, which was essentially how to analyse systematic reviews and provide some feedback to funding organisations, for want of a better word, on what to fund, what not to fund, or, just provide the information so they can make those decisions about that. And then a few things were happening along the way. In 2003, our first child was born, quickly followed by a second daughter in 2005, by which time we're back in New Zealand. But a number of my parents' friends were becoming more and more ill with type 2 diabetes, which are sort of, was relatively rare, really, through the earlier part of the century. And the more I was reading, there was this whole big tsunami of non-communicable disease sort of playing out in New Zealand. With you go to events and you see a lot of older people with lower limb amputations, particularly among Māori. But then my daughter required a gluten-free diet because she was diagnosed with non-celiac insulin sensitivity back in 2009 when she was about 4 years old. She's now 17. Older daughter's now 19. And then we embarked on that whole nutrition journey, but a lot of the food substitutes for bread and other carbohydrate-based foods were high in sugar, but they tasted awful. And so there was a bit of looking around for other alternatives. And then the low carbohydrate movement that was really driven in a huge part by people like Grant Schofield, Karen Zinn, Cliff Harvey, and a range of other practitioners was taking off in New Zealand a bit more, so got more interested in that. And then, I'd always sort of had a desire to do a PhD, if I could get the opportunity to, and the kids were getting a bit older. They were early teens, so late childhood at that point. And then did some reading around, okay, you look at what puts kids in hospital, and the most common cause of hospitalisation for children in New Zealand is the removal of multiple teeth for preschoolers under general anaesthetic. Like 29,000 children per year under the age of 14 and under will have a tooth removed for decay. Mm-hmm. And several thousand of those are preschoolers at the cost of $150,000 a day. And that's just a massive expense. It's entirely preventable. But we've got this massive problem of diabetes at one end, and then you've got early childhood. They're two public health problems. But and then so the PhD was sort of exploring that journey, looking at the evidence of foods that are associated with harm and with benefit, and then evaluated that evidence against the dietary guidelines. Then did a whole series of studies looking at the knowledge of foods for oral and general health, which should always be regarded as the same thing. And, we've found that most people's knowledge, and that included health professionals as well too, of foods that were good for your health, pretty much dovetailed with dietary guideline advice, which was really interesting. Yeah. And that there seems to be very little awareness, for instance, that fat-rich foods and vitamin D-rich foods, such as what we find in grass-fed beef, are actually beneficial for your teeth.
It is an enormous topic. Thank you for giving the overview of your interest, because your PhD, I found it really brought the geek out in me, and I found it really fascinating.
Me too.
And then we had a few conversations, as we've said, while we were over there in the Gold Coast in the sunshine. And your history of how you got into that and interested in that topic, it is quite multifaceted. And you've had those personal experiences with your sister's health initially, and then I guess that experience, and as you said, opened you up to awareness, and then your parents' relationship with food and their friends, and then your own daughter. So your daughters, you mentioned just briefly there, they're now late teens, and one of them is off at university. And what's their relationship with food? Or have they got an interest in nutrition themselves, or are they sick of it?
What sort of feels like a bit of a triumph, really, is that our older daughter just needed a break from the concrete jungle that she was finding Auckland to be. And so she came back to Taupo with us for just a couple of days over a long weekend. And we asked her, well, is there anything you'd particularly like us to make you, since you're home and you've been putting up with hostile food? And she said, Mum, I just want to have steak and salad. And she said, I don't care if I eat that for 3 days. And so that felt like a bit of a win. They are aware of the importance of eating a healthy food and minimising the intake of junk food, which is really good. And that sort of leads us into, sort of what we find with, feeding and families and family life and eating, that sort of thing. But there's a few things. Yeah, both of them, I think they've got good skin. They're fit, healthy, doing fine, which is really, really nice, and as fine as, kids do these days. Interestingly, what we found over the first lockdown was just a very brief story, but we found that, we just let them sort of do their own thing. They were fairly committed to schoolwork and wanted to do well at that. And so they'd get up in the morning and they'd get on and attend Zoom meetings for school. But we'd finish up having family brunch mid-morning rather than just getting up and having breakfast and then having lunch. We'd sort of work out, what time we could all do things. I was finishing up a PhD at the time. My husband was at home and, staining the fence on the deck and doing all sorts of things like that. So we're all being a bit productive. But you got to realise how the school day does actually force you into a pattern of eating when you don't want to. Like, they weren't ever that keen on having breakfast, but it was a case of just having to, just have it now because you're not going to get an opportunity to have anything. But actually, we all found out that we all preferred to eat at about 10:30 in the morning. And then they'd go through absolutely fine till about dinner, really. And so, when you don't have stuff built into the day, like having to have breakfast by such and such a time and having to have lunch between this hour and this hour, you actually can eat quite well, and they're busy and active, and they're just going through life.
It's interesting, that point about you all naturally tuned in to when your body was waking up and wanting the food. We are regimented, whether it's around our office work or around the school, and we've been trained really to eat at particular times. And I definitely worked with a number of different clients and families who really ingrained to eat breakfast, even though they don't actually feel they need it or want it or enjoy it.
Mm.
So yeah,
Yeah.
it's interesting that intuitions, we've kind of stepped away from it. You mentioned earlier when you were explaining a little bit about your history and how you got interested in your I think really interesting topic. That was it 29,000 school-aged children are hospitalised and with tooth extractions.
Not so much hospitalised, but they'll lose a tooth, or they'll experience tooth decay. But it's the several thousand children in New Zealand who are under the age of 5 who are being admitted to hospital for the removal of multiple teeth under a general anaesthetic, because it's quite a tough operation and it's painful, and it's easiest to be done under general anaesthetic. And this is like multiple teeth are coming out at once, and it's just it's really sad. It's a pretty horrible operation to perform for a surgeon or a dental surgeon to have to do that. And, when it's entirely preventable, and this has taken place in such an early point of a child's development, at the time when they're learning to talk, they're communicating, learning to smile, learning to get on with other people. But yeah, it's that is quite difficult. And unfortunately, you can't blame the kids. And in many ways, you can't blame the parents either. And, you look at all these operations occurring in populations that are already vulnerable because of socioeconomic status, we know is quite closely tied up with, increased, or it's associated with increased caries burdens. But also, this is happening in different ethnic groups as well too. And that's quite tragic, really. But the food supply in places characterised by certain levels of socioeconomic deprivation is pretty toxic.
What you were presenting at Low Carb Down Under, and it does come through in your work, but inequalities is a feature. Health inequalities around socioeconomic, and I'm hearing New Zealand has particular issues around those health inequalities. Your PhD, we've mentioned it a couple of times. It was in public health, and you studied that in New Zealand. It was called Healthy Mouth, Healthy Body. Was that right? Towards integrated dietary approaches. And it was very much around, I likened it when we were chatting to W.A. Price. I know that's that was a study many years ago, and it was a dentist who travelled and looked at Indigenous populations and why their dental and bone health was so strong compared to modern Western diet societies and civilizations. So I likened it. It kind of reminded me very much of that. Do you want to delve in? It's a big topic, and let us know some of your key thoughts or how you put that together.
Yeah, I think what is tragic is that when he did that study, and it was just slightly short of 100 years ago now, when he was in New Zealand, and that he found that the healthiest people in New Zealand were East Coast Maori of the sort of Eastern Cape of the North Island. These days, they have some of the worst health outcomes in New Zealand. The childhood tooth decay rates by age 5 and also by year 8, which is, say, your 12 and 13-year-olds are as bad as they are, or if not worse than most parts of New Zealand. And it's just, and those were findings that were replicated worldwide, in all sorts of places where it went. And you sort of think, gosh, the large scale influx of increasingly refined carbohydrates has been really problematic for dental health, but not only that, for the general health as well too. But the dental health thing is essentially, it's a canary in the coal mine for poor metabolic health. And this is where we sort of think, well, there's a lot of effort going into trying to achieve remission of type 2 diabetes and prevention of non-alcoholic fatty liver disease. But I think there's a case to be made for prevention earlier in the lifespan, and that possibly the presentation with dental caries in children, because what we do know is that childhood eating is quite a proxy for how a family's eating as well too. So if there's an established eating pattern of multiple eating episodes per day of refined foods, well, there's probably other people in the family eating like that. And so I think even around pregnancy and childbirth, when people are engaging with the health system, well, they're healthy, and in the process of having children. And, because there is more engagement in that health system because you're going for these checkups. But I think there's an opportunity there to actually provide families with some really good advice, especially around about the time that family life is going to change anyway, because, they've gone from being a couple to having children.
They're in that system with potential to grab hold of them and give them support and the right kind of information and pick up early points that maybe we want to flag to them and help them to address. So that canary in the coal mine, that was one of the really fascinating things that really came through and shone from your work, your presentation that I heard in the Gold Coast. It was, I think you used a phrase, and I've probably not got it quite right, but inside, I haven't got it quite right.
Oh, yeah.
The dental cavities, we're often thinking of them as society and even as practitioners in oral health. We're looking at the plaque and the bacteria and the dental problems within the mouth and coming from the immediate mouth source and digestion and contact with sugars. But your work, a significant aspect of what you're bringing to light is it's an indicator of something else. So do you want to tell, you can explain it much more briefly than, do you want to, just because you've mentioned that, it would be great to kind of just get that point over, much better than I can.
Okay, let's have a go. Hey, I got, all the way through, pretty much dental caries is referred to as that localized destruction of the tooth in response to, the production of acid in the mouth through the bacterial fermentation of carbohydrates. So, you've got all these bacteria in your mouth that have been there for, all through human history. And, you sort of have a high and frequent intake of fermented carbohydrates. And so you're going to get the bacteria are going to metabolize those carbohydrates and produce acid as a byproduct, which lowers the pH in the mouth to critical levels below 5.5 is when enamel demineralization will take place. So caries as a process starts off as, those white spot lesions on teeth and then, gradually moves through or can do very, very quickly with severe early childhood caries to, a cavitated lesion, which will need a filling or something like that. But at early stages, as long as your intake frequency of high carb foods or snacks isn't high, your saliva remineralizes your teeth. And that's produced from your salivary glands, largest of which is your parotid gland. So you can actually just rub this here and you can actually produce some saliva and slosh it around your mouth and you've remineralized your teeth. But then we do get acid into our mouths through different sources that are, for instance, people with gastrointestinal reflux will quite frequently have acid in their mouths, but that's not associated with the level of decay with the high sugar diet. People with, or if you have citrus drinks, that's associated with enamel erosion, but not so much the decay. But there's something about that high sugar diet. And so got reading around things like is there a systemic cause for dental caries, and so I started reading around enamel erosion and things like that and sort of went down a few sort of rabbit holes. And then sort of got reading about the function of the parotid gland and the dentinal fluid flow from which your tooth is nourished internally through the pulp. And, because the pulp is the only part of the tooth that has a vascularized blood supply, obviously, but it's also got the nerve supply as well too. So I started reading about dentinal fluid, and what I came to find out through reading other people's papers is that the parotid gland also obviously is involved in the secretion of parotid hormone, and that controls the flow of dentinal fluid inside the tooth, into the tooth. So with a modern dietary lifestyle with a very, very high and frequent intake of carbohydrates, what happens is you get some oxidative stress because of the malfunction of mitochondria and the hypothalamus. And it's the hypothalamus that controls the hormone signaling to the parotid gland. Okay, so what happens with that high and frequent intake is that interferes with the production of parotid hormone, which then interferes with the dental fluid flow. So then you get a malnourished tooth, which is deficient in vitamins and minerals. And then it's that much more vulnerable to the acid attack. So it's kind of like a dual process model. You've got all this outside in stuff happening with the enamel erosion, but it's also hitting a vulnerable tooth that is malnourished. And we know that children born to mothers with vitamin D deficiency have problems with enamel development as well too. So there are all these sorts of things happening. There's the vitamin D deficiency that's associated with dental caries in the young, and poor enamel formation, poor tooth formation for a start. So you've got these vulnerable teeth. But when you've got this sort of oxidative stress and this inflammatory process going on that's interfering with the nourishment of the tooth, and that sort of explains why the high and frequent intake of refined carbohydrates is associated with the dental caries thing. Because we've known for a long time through multiple sources of evidence that, your sugary drinks and your high sugar foods are associated. But with your refined starches, and this is quite interesting because what happens is that they, say if you were to have something like a refined starch and sugar food, like say a crumpet with jam on it, for instance, while that crumpet might not necessarily be sweet, the starch in that actually holds the sugar onto the teeth for longer. So they compared sort of like, what was going on inside the mouth when people were eating salted caramels, lollies. So they get a very high increase in the sugar levels in the mouth and a sharp drop in the pH. But then those products are being cleared a bit more quickly. But with the refined starch, it actually holds the sugar in the mouth and holds the pH at critical levels for enamel demineralization for longer. And so you've actually got a very acidic environment in the mouth, even with the intake of foods that are not necessarily sweet, and especially when they're consumed during snack times as well too.
Yeah. So they're vulnerable in multiple ways, and the starches are having an impact, but we're not necessarily aware of that. But and then just to kind of drive home that point, a light bulb moment really that dental cavities could be treated as an early indicator of deficiency, or a warning that we could be addressing and improving our diet to prevent. And this is something I think your work is definitely kind of looking at and potentially wanting more investigation into. But could it be preventative for disease later down the line? Is that something that you're hopeful for?
Definitely, yeah. Because I think almost by the time you're returning a positive, an HbA1c that's indicative of pre-diabetes, it's essentially the start of end-stage disease. That's it's where the pancreas is really struggling now to keep up with the insulin demands, just to try and keep the blood sugar down low. And so what happens is that there's some malfunction happening there, and people are returning a blood test indicative of diabetes or pre-diabetes, and then so there's a whole cascade of really nasty events that can happen, whether it's the the cardiovascular disease, neurodegenerative disorders, liver problems, kidney problems. You also get periodontal disease as one of those co-presenting conditions with type 2 diabetes as well too. There's, tooth loss is quite, occurs quite a bit in, people with diabetes, which of course then sets off another horrible set of events where it's difficult to chew the foods that they could probably do with chewing. And of course the dietary recommendations for high carbohydrate diets. Yeah. With the starch thing, I'll probably just better qualify that by it's the refined starches that, it's that process of gelatinization. I'm not about to say that potatoes, for instance, cause dental caries, that sort of thing, but we're looking at definitely those bread and cereal based foods.
Ultra processed foods, really, highly refined and so refined, so polished that they can cause those pH differences and within the body system spike blood glucose. With our food environment, this could be used, as we're saying, potentially as an early stage intervention. You've already mentioned the opportunities there within with partnering up with dentists and those disciplines and community health discipline getting kind of in there with education and support. What does it say about our food environments? What are your thoughts? Because you mentioned the stark, shocking difference with New Zealand health, how it's completely flipped around, and the obesity, the rates are shockingly high in New Zealand, and so are diabetes type 2. And as you're saying, that's kind of late stage there, and we could be kind of going in much earlier. Yeah, I'm just trying to bring it back to the food environment and what families could take on board.
I think there's the awareness, and it's actually really difficult in New Zealand because it operates at multiple levels, the food environment, and how this can be toxic to health. And I'll give you an example. As part of the PhD study, did some formative research, some focus groups and kids, and then semi-structured interviews with parents and health professionals even as well too. And the kids were saying that, there's parents will pick them off with a healthy lunch, but there's all these food fundraisers at schools, like sell a box of chocolates, and for every chocolate box you sell, they get a donation from Cadbury or something like that for, sports equipment. So there's this conflation with, junk food with healthy activity like sports. And then you've got the advertising where it's just pretty much running amok in New Zealand. And I'll give you another example of that. During the level 4 lockdown in New Zealand, we couldn't go and get takeaways or anything like that. They were quite strict lockdowns. They'd have these, a current affairs show were running the isolation games where you sent in your video of yourself doing some fun family activity, but it was in your backyard. And at 7 o'clock in the evening, this was on, but it was sponsored by Pizza Hut. And the prize for the best video of the night were Pizza Hut vouchers for you to go out and blow on pizzas when the lockdown was over. And it just sort of seemed incredible that sort of advertising is allowed at that stage, given the harms that these sorts of foods will have and the drinks that go with them and the chips and everything else. Yeah, so we've got a food environment that is toxic, and families operating within that is actually really hard when you've got that at sports venues, at eye level at the supermarkets. And so I think there probably needs to be a societally wide focus on reducing the impacts of that and actually promoting the fact that this is as harmful to kids as smoking. And what came through in one of the focus groups with the kids is, they were talking about the fundraisers at school and the fact that often they see their parents who wouldn't allow soft drink in the house, but there they are selling soft drinks at school fundraisers. That sort of thing. You can still see how that works. And I said, so what do you think? Do you think these things are really unhealthy? And they said, well, they can't be that unhealthy because their school teachers are letting these things onto the premises. And then one kid, he says, well, it's not like alcohol and cigarettes are being sold at school. So there's a difference in how we see those harmful substances compared to how they might see sugary drinks and that sort of stuff. And, and you sort of think, well, it's a treat. But if you're getting treats like that every day, whether you're up at a sports ground, that sort of thing, and it's actually really hard to negotiate as a family when you've got active kids doing music, sports, sort of been there, done that. And, I think the main thing is just to try and control what you have in your own home.
Yes, and to bring your children in with education. I've got, so my daughter's pretty good. They're both pretty good, really. They like a lot of real food, whole foods, and they do a lot of cooking, particularly my son. He's 12. He's the chef of the family. He really loves a chef from Australia called That's What I Reckon, actually. And he follows his videos and he'll make us really delicious recipes like roast pork belly and that type of thing. Really, really lovely. And so generally we're pretty good, but every now and again I'm hit by a complete, you've tried those sweets or you've had that. And, as a nutritionist, I'm going supporting families and helping them and trying to kind of learn their obstacles and barriers. And then I'll hear that my son's eaten some absolute junk food or swapped his lunch for something particularly nasty. I'm thinking, oh my gosh, I'm still on the journey. And it's not simple. It's really, it's not well, give us the education and tell us what's bad for us and we'll change it, because families are up against it. And, the temptation is everywhere, and the mixed messages. I was gobsmacked when I went into a local school in Australia and I was delivering some nutrition workshops. The knowledge of the children was amazing. I was saying, "Oh, do you know what's bad for you?" And within a few years of talking to that same age range, their knowledge, had shot up. They were saying, "Yes, these are the bad for you foods, and this is why they're bad. And they could give you diabetes, they could make you fat, they could give you cancer." And they were 9 years old, and their knowledge was amazing, but they're still eating those foods because there is that disconnect. The disconnect you mentioned earlier with the oral health being treated completely separately to the rest of the medical world, and the disconnect with our knowledge about what's going on with the mouth being a warning indicator of what's going on in our bodies and dysfunction within our body. And then we've got a massive disconnect with messages we're teaching children. So they've got it theoretically, but then we're giving them those foods as a bake sale treat or as a cancer research fundraiser, which blows my mind still. And all of those mixed messages. And Halloween, we just had Halloween here.
Oh, I know.
That was just a phenomenal amount of treats. And I mean, on a side note, the plastic that's packaged around them now is crazy as well. My daughter went trick-or-treating and sold me back all the candy. She makes a killing. She gathers it up and then
a profitable exercise. Yeah.
A businesswoman. Yeah. So it's not easy, but what's your own personal approach to food? Because even when we're all trying to be good, and we went to the conference, and a lot of us kind of try to eat whole foods or low carb foods, or some of the attendees are stricter. And what's your own personal approach?
I really liked what you were saying before about the fact that your kids are cooking meals, and actually that's a really good way of getting your children at a range of ages just involved in food preparation. So they're a little bit invested into it, and if they've prepared it themselves, and especially if you're saying, okay, well, it's got to be a meal, it's got to consist of this and this, they're going to want everyone to eat it as well too. And so that's a really good thing you do. So, I encourage people to get, their families involved. I think actually aiming for progress and not perfection can be quite useful. And so what I mean by progress is just keeping some control over what you have in your house, but accept that, when your kids get to early adolescence, and this was probably my big mistake, or mine and my husband's big mistake, we sort of decided to announce, right, this is what we're doing. And of course, everyone's at different stages of sort of being on board with that. And we had one who was 13, she sort of said, don't know about that. And of course, she had a paper run and she was starting to do other jobs. So she had a little bit of money that she could just go out and have with friends. And so there was a bit of a rebellion. But then I think she discovered that she was feeling a bit awful. And then she thought, all right, I'll try all of this. And then her skin cleared up and, and of course her friends sort of said, oh, you've got great skin. And I mean, I could have told her that, but sometimes they need that feedback from other people who are not their parents. So I think, and there are ways to go when you're deciding to engage in nutrition change for your family. You can either go all out, but sometimes that's going to be met with a bit of resistance. And kids, especially if they're approaching that early teenage bit, where they're starting to make decisions about what they're eating outside the house, you kind of have to let it go a little bit, because they're going to go and eat hot chips with their friends, and they're going to go do this with their friends, and it's nice for them to have a social life, that sort of stuff as well too. But it goes in hand with just keeping kids busy and active through the primary school years, and the habit formation is quite important around, and you have a bit of control around how you feed your families, or how you feed your children when they're sort of that 0 to about 10 or so. You have some control over that, and just try and get some good habits in place. And that sort of goes with, all the other habits, not just around eating, but getting some exercise, getting the time outside, reducing the screen time, getting to bed early, not having devices in the bedroom, sleeping well. There's all those things are bidirectional, because if you've got the nutrition right, then they're going to want to actually be able to go exercising. If they're achieving satiety, for instance, at meals, you're not going to need to snack, I think. And sometimes that's quite good to implement during the school holidays when, you're not possibly bound by some of those routines around getting up and going to school. You can sort of live a little bit more free range, for want of a better phrase. Yeah, so just acknowledging that there are going to be differences and just working on progress. Just have some controls around what you have in your house. If you've already got, some of those more higher carb foods there that you might not have, stick them in your survival kit, for that natural disaster or an emergency that you hope won't happen, but just might. We've had some personal experience of that ourselves. I was living in Christchurch at the time of the Christchurch earthquakes, and so normal living was sort of out the window, and it was stuff in the survival kit like the cans of beans or chickpeas and tin of tomatoes and, that sort of thing. So, so just keep some controls over what you have in your house and the sort of behaviour you have in your house as well too, whether it's, exercising and engagement in sport, but just getting to bed early, because, if you sleep well, you're going to eat better and you're going to be more motivated to exercise. So it's those sorts of things around being a healthy family, which are quite good. There's parents, especially mothers, they can engage in that quite negative self-talk around their own dieting. And I think, dieting shouldn't be on a wagon or off a wagon. It's just how you eat, and we're all human and we're all operating as human beings with other people and their own cultural and social eating laws. And so, if you find yourself eating, I don't know, dessert out or something, it's not a case of thinking, oh, well, we're blowing it now. Tomorrow's always a new day. You can just pop back on. And what you do the majority of the time, I think, is more important. But I think for family eating, just try and minimize the intake of processed foods and try and serve up meals by which you're going to achieve satiety. And so I think, make sure that there's plenty of fat and protein there as well. And that's probably the most important thing to sort out as far as meals go, I think, is making sure there's sufficient protein and fat you can be full and not need to snack.
So feeling full up from that meal by having the fatty meat cuts or the eggs and different proteins. A lot of us aren't eating adequate protein. But I liked all of those suggestions. They're really pragmatic and helpful. Controlling your own food environment and eating the same way as much as possible, having good routines and good habits, and then not beating yourself up. If you're getting 70-80% good and your lifestyle is feeling good and you're healthy and your energy levels are good, then not necessarily beating yourself up, particularly if you've got young children or adolescents who are making other decisions here and there and trying, and which is natural. And it's something that as a nutritionist and potentially a zealot about healthy eating, having to navigate those exact issues that you're mentioning myself and let my son and let my daughter make their own decisions and make bad choices sometimes on unhealthy foods, but experience how you feel, which, I hope they feel bad from them, but actually sometimes they're absolutely delicious and they feel great. And we've all done that. We'll have our kind of snacks and bits and pieces. So loads and loads of good information in there. Thank you. Where can we find out more about your research work and your work? What
I'll do is I'll send you some of the links to the publications that have been published so far. I'm setting up a Facebook site at the moment, which I'll put some information about that and also around other things like fluoridation and oral hygiene, those sorts of things as well too.
Lovely.
And and I'm on Twitter at SJ Hancock NZ is the handle. Yeah.
Excellent. I'll pop all those links in to our talk, I believe our talk, so people can follow you and kind of get hold of your work, and I'll definitely be looking into that Facebook group when it goes live. Finally, thanks for all your time, and I really love chatting about this subject and your work. But finally, what resources would you suggest for families if they wanted to research more or begin their own journey of health change? Is there a particular book or talk or paper that you suggest for them?
I've got a couple of resources. There's a website called ditchthecarbs.com, and that's run by Libby Jenkinson, who's a pharmacist in Auckland in New Zealand, and it's amazing.
Mm-hmm.
And she's very much of the whole progress, not perfection. But she has a ton of recipes on there, and there's quite a lot of resources there for families of young children, and, just ways to substitute and swap out, so if you wanted to make shortbread, for instance, she's got a low-carb version of so many things that people like to eat. So that's a really good resource as far as books and just a website to go for really good practical advice.
Excellent.
A really cool book to read around dental health and diet is The Dental Diet, and that's by Dr. Stephen Lin, who is an Australian dentist, and he's based in Sydney. Yeah, so that was a really excellent book for me to read, and it's sort of the process of reading that sort of threw up more questions that I was able to go off and do more research around as well too. But he's got, some really sound good advice in there, and it's very well researched, and so that's a really good resource. And a podcast to listen to for anyone who's into the health and nutrition space it's called Mickeypedia, and it's run by Dr. Mickey Williden, who's a nutritionist in Auckland, New Zealand. It's Mikkeipedia, sort of like Wikipedia, but it's Mickeypedia, using a play on her own name. And she drops great episodes on a weekly basis with all sorts of people, and she's also an expert also in women's health. And, especially, for people entering that and menopause or perimenopause stage. So she's a really excellent practitioner in that as well too.
Okay, fab. That's good for me to get some new resources out of our chat as well. Thank you. I'll check those out, and I'll pop all of those links in our chat underneath it, and some more information about you. I really appreciate your time.
It's an honour and a privilege to have this interview opportunity with Claire. It's been great. Really good fun.
Awesome. Thank you. Big thank you.
Okay. Bye.